Sanchez. I am a specialist in cosmetic medicine and devices, medical devices. Today we would like to show you one protocol, one treatment, one case of one lady of age 45 who has undergone one treatment with a Energy C 2.0 device for slimming, for body contouring. Exactly, she has lost one size, so about 3 centimeters of abdominal contour in one session, and we want to share with you this case, this procedure. It's a non-invasive kind of treatment which lasts 50 minutes, and we are happy to share this information with you in this commented video. So let's launch the video first, and I will proceed. I will follow up the procedure with you together so that you understand what we're doing. First of all, I would like to introduce our professional, Mr. Piñero, who's a physiotherapist specialized in dermofunctional physiotherapy, who will be leading the treatment. You will see that all this event has been filmed like a webinar because we did the treatment live when we emitted for first time this protocol, but we decided also to give the opportunity to all these other people who have not seen the procedure to be able to catch up with this other filming with a much more guided video for all of you. Okay, so first of all, we welcome our patient, who is a young lady, age 45. We ask her to, first of all, to give us any health instructions from her health. So we will see if there's any contraindication she would be eligible to before starting the treatment. And the first thing we will be doing is taking some biological bioparameters like her height, her weight, her measurements in the abdomen, and also analyze through a bioimpedance machine the amount of water and fat in her body. So this will help us to understand what's her initial state and how we can help her by doing this procedure. It's important to get all this information, also pictures, as you will see. We are taking right now front and sideways, because once we are done with the treatment, we want to know where this volume or these sizes have gone, either in weight or in centimeters. So it's important for us to understand what type of patient we have in front of us and being able to see what's the evolution and why. The first stage, after we've taken the measurements and we have done the pictures, is measuring her body percentage of water and fat in the body through an in-body scale machine. This is a scientific kind of device which provides us some objective information on the general state of health of the patient, and allows us to know what if she is overweight, and if so, where is the most concentration of this weight. So for example, in this case, she weighed 70.3 kilos and 19 kilos of muscle. We will afterwards compare the factors of the measurements we've taken at the end of the video. So right now we will just show you how we did the whole procedure. For us, it's very important also to take the measurements, because weight sometimes is only one indication, but whenever we deal with inflammation and there are other kinds of problems like the leaky gut syndrome or other kind of intestinal disorders, we observe how there's a major reduction in inflammation. So consequently, it shows up with a reduction in sizes. So that's why we want to be very precise where we measure. That's why we mark. We get a little sign on the backside of the patient, so that we can afterwards have the same guide to proceed and to take the second measurement once we've done the first, when we've done the treatment. Okay. The next step to start with the treatment is place some elastic bands on the bed, on the couch, We will now place some passive plates on top of it, which will be adapting on the lumbar area of the patient, and we kindly ask the patient to lie down on her back to start with the procedure. This procedure will have 3 stages, 3 steps. The first one is vascularization. We will proceed to activate all the circulation of the abdomen so that we can improve the lipolysis. We can improve the mobilization of the fluids which are stored. We will improve the metabolic rate of the patient herself, as we will rise between 1 and 11 degrees per session. And this means that every rise in 1 degree means a 12% of increase in the metabolic rate, in the metabolism. So this means that just by being submitted to the treatment, the patient will burn more energy, just because we are activating her metabolism. So the first step is applying these kinds of plates on top of the abdomen, where all the fat, the visceral fat, is located. So we are actually targeting abdominal fat, can either be subcutaneous but also visceral. So we will work on both targets together. It's important to always ask the patient what is her health background, because this kind of treatment has some contraindications. Like, for example, in case a person has pacemaker, she's not eligible for doing the machine. In case this person is under a bacterial infection, she's not eligible of doing this kind of treatment. But if not, she's a healthy person, there's no side effects or negative side effects on this procedure. So the next thing to do is to place the parameters that we are going to use for the treatment on the machine. That's what our colleague is doing right now. And these parameters depend on the person, because they're very customized. They're very personalized too, according to the patient. Once we feel the parameters are correctly set, we ask the patient to tell us, to indicate us if everything's okay, because we will be delivering her like a security control, which will allow her to take control over the whole procedure. So if she finds in any moment a bad sensation, or if it's too hot or anything happens, she can simply stop the procedure. The sensation of the patient is nice and warm. It's an increscendo kind of inner warmth that comes, and the patient lies comfortably, with no needles, with no invasive procedures, with no pain during the whole time. At this stage, the machine is doing 3 complete procedures, targets, health targets, we can say aesthetic targets. First of all, we are doing an active lipolysis, so we are burning the fat out of the fat cells, which will allow us to burn this fat according to the increase in metabolism. Second, we will drain the fluid, so all the liquid retained in the abdomen area and also in the lower limbs during the menstrual cycle of the lady, of the woman, will be forced out of the body. And in the third stage, we will increase the metabolism, as we will rise 12% metabolism per every degree in temperature. We will be risen at this stage. Also, we have to bear in mind that the target of getting into 42 degrees will allow us to generate collagen type 1, which is the cutaneous type of collagen. This is very important because at this stage we will support the tightening of the tissue and will avoid the sagging or the flexibility which can be produced after we lose the fat. So at this stage, it's very important to know that we have these 3 kinds of procedures, these kind of effects. Now, Esther shows us how she's going to start the second step in the procedure, which is applying a conductor cream with active lipolytic principles substances which will allow us to induce the vascularization of these products inside the skin. It's important because now she will exert a manual massage both with two kinds of hand probes. Each of them has a different nature, so they work differently for different types of tissues. So there's one hand probe which works specifically for the tissues rich in water, which is a capacitive, so it allows me to treat correctly muscle, and the other kind of hand probe works specifically on tissues poor in water, so it helps me burn more, activate more tissues with less kind of water, so this is mostly fat. So we combine these two procedures together with a manual massage that is adapting, again, the parameters of the device to the lady, to the patient, so she will have the best results possible when you combine both things together. And she will proceed with a manual massage, both in the abdomen, treating the rectum muscle and the gluteus muscle in order to give shape during about 15 minutes. This procedure takes place during 15 minutes. As you see, it's a gentle massage. There's no pain, there's no sparks, there's no harm. The patient lies comfortably on her back during the treatment and experiences a nice relaxing sensation. Once these 15 minutes are over, there's the third stage coming now. The third step of the treatment, well, the professional removes the cream from the patient. And now there's a third procedure, which is the drainage. So once we have already vascularized and cleaned the blood on the abdomen, we have mobilized, we have moved all these muscles and all of the fat and the toxins in the abdomen area, we will now launch them to the removal organs in our body. Okay, at this stage, the lady may have the need to go to the toilet because we are already activating the diuresis. So she may go to the toilet, she may come back, and we continue with the third stage, which is the lymphatic drainage. This drainage is done by placing the actives on the lumbar area, the actives on the soles and the passives on the lumbar area. And with this procedure, we will move all the fluids from the lower limbs and at last the whole circulatory system, both arterial and venous and lymphatic. So this will improve all the pumping of fluids and will give the patient the possibility of removing all these fluids by the different emuntory organs, which are the feces, so we can flush in a solid way through urine. So the toxins will also be removed by the water, by the urine. They also exhaled when you breathe, so they will be also expelled from the body through the respiration from the breathing process, and finally also through the skin. So the sweating does also increase the removal of all these toxins. So it's very important to know that the treatment works in a base of a global level, not only regional, local level, but also works in such a way that we will improve the effects both in the nervous central system, so the person will feel more relaxed, with less stress, much confident, and also in terms of hormones, because when we work, we activate in some way a much calmer attitude in the body, and we balance, we can say, the nervous system. We also improve the functioning of the hormonal system, so it helps us bring together the wellness and the beauty concepts all together. Now the patient has to stay during 20 more minutes during the drainage. We are using a 2-channel machine, so this means that we have to go step by step on all the procedure, because there are other machines which have more outlets and allow us to go slightly quicker. But this procedure specifically lasted 50 minutes. And once the treatment is done, these 20 minutes are done, we will finish the whole beauty procedure for abdomen reduction. Then at this stage, we will measure again. So we will do the measuring back again, the pictures again, and also the bioimpedance in body again, to know what's the after treatment state of this patient and how she has reacted. So it's important that we are able to go with all this data in order to understand how this technology is effective. The professional removes the plates right now. And she's tasked to be placed in the same place, to take the pictures and to do the measurements again. Let's see now how the measurements go. We will show you after the pictures which we have done with this cell phone, so that you can see the difference. But I remember you, this has been filmed for a webinar, so it was live when we recorded it first time, and that's why maybe the quality of the image is not as good. But at this stage, we wanted to show you more how this that you are we are able to provide a new technology which will have an immediate anti-infective result straight away, just by laying down on a couch, than rather making a very elaborated filming which won't show the actual procedure we do in all the clinics that run also our machines. So it's important that you know that this technology exists, that you don't have to undergo a complex surgery, or you have to suffer from the scars, infections, and for the pain that may have, which you may have if you get into other kind of surgeries. And yes, I mean, technology gives us a lot of options that you are there for you to handle. It's just a matter of you knowing and being able to have the opportunity to try, to give them a try. As you see right now, we are making the in-body measurements again to see what was the amount of water and fat in the body and the weight. Once the machine does all this reading, which is done by a low frequency current which passes along the body through the two handles of this unit, you have a report which is printed out and gives you some data referring to the body weight, the amount of water, the amount of fat, and also the corporal mass index, which states if someone is on her normal weight, if she's overweighted, or if he or she is obese. Okay, so now the third stage would be doing the measurements again to see what was the difference. So we have the pictures, we have the measurements taken by the in-body bioimpedance machine, and now we are going to do the recording of the perimeters of the abdominal area. Okay, just like before, we follow the tracks we have marked in the backside of the back of the lady. Okay, it's important we always follow the same measurements of same lines, so that we have the correct measurements after the treatment. This is the navel one, and the third one is the low abdomen. Okay, so now we have all the data. We have been able to collect all this information before and after, remembering it's only one session, is the filming of whatever we did. And now we are going to put in the screen the evaluation of one and another so that you can see the difference. In this case, remembering it's 50 minutes, one session. Right now we can see into the camera is 69.7. So there's been a reduction of about already 600 grams in the procedure. You can actually see in the first stage a reduction in this specific case of almost of a little bit more of half a kilo. So it's not bad. I mean, just for 15 minutes being laying on the couch is not a bad option. But of course, it always depends on the person. It depends on the machine you're using, on the amount of energy you're introducing in the body. Right now, we will print on the screen also the differences between not only the in-body measurements, but also the measurements itself and the pictures. So let's see the pictures before and after, please. You see also the measurements. As you can see, there's been a reduction of 3 centimeters in the abdomen. Also, we can see the video, how the person moved from one side to another, so you can see also the results. And yes, that's what we do. That's what technology has to offer. So it's possible to have immediate results, good quality results, which are sustainable in time. So this is only one session, but just imagine what you can achieve just by having a series of sessions. I invite you all to take a look at the clinics which are available in your area to give a try. And here right now we will be printing the name of the directory of the website where you can locate a nearby clinic to try. So I invite you to give it a trial, to go for one go and see what your specific experience is like. Thank you so much for joining us today and for sharing with us all this information. And we look forward to seeing you in the next opportunity for another case done with the Cap Energy technology. Thank you very much for your time and have a nice day.